Hello everybody and welcome to today's class. My name is Vanessa Lardo and I work for Beaver Medical Group as a corporate health and wellness educator and registered dietitian. So welcome to today's class, What to Expect When You're Expecting. So today we're going to be discussing a couple of different things. It's a pretty short talk, but basically we're going to go over some different aspects of pregnancy, what to expect with your clinic appointments, your doctor's visits, as well as some things about COVID-19, especially around this time. There's a lot of uncertainty with our pregnancies and our pregnant women, so we want to be able to put you guys at ease, give you a little bit more information on that. And also we're going to go over what to look for with postpartum as well, some resources that you might find useful if you're having, after you give birth, if you're having anxiety or depression. So we'll give you some resources with that, as well as talking about premature birth and those different types of things. So in a nutshell, we're going to be going over a couple different aspects of what to expect during your pregnancy and some resources for after you have given birth. So let me ask you this question. What is the first thing that you should do after you find out you're pregnant? It's a super exciting time. You run and tell your husband or your significant other, whoever that may be, and you let them know, hey, I'm pregnant, I'm super excited. What is the next thing you should do? Should you run and tell your mom the great news, or should you schedule your doctor's appointment? So if you thought to yourself that you should run and tell your mom, you can definitely do that. But right after you've done that, it's definitely important to try and reach out to your primary care physician and see about getting set up with a doctor, an OB/GYN doctor, so that you can start to get your visits scheduled for the upcoming months. If you're thinking about becoming pregnant, you should also schedule an appointment with your doctor just so that you can go over what types of vitamins you should be taking ahead of time just to prep your body, and also just asking them other questions just to get yourself ready, your significant other ready for this baby to come. So here are some tips for preparing for your doctor's appointment. So whether your appointment is now being held via telemedicine or in person, there are different things that you want to do and different questions that you want to ask. I know for myself, a lot of times when I don't have those questions written down, I tend to start talking to the doctor, and by the time you know it, I've completely forgotten all the things that I wanted to ask them. So I usually try to write anything down as I go along. If there's an appointment that I have coming up and there's some concerns that I have, if anything comes up in the meantime, I have some sort of weird pain or anything in particular, I will write it down. That way when I do talk to them, I can always remember that, hey, on Tuesday I had such and such happen to me. What could this be? So write down your questions, ask about any costs and fees. You want to make sure that you are aware of how much you're going to be spending. If you're thinking about becoming pregnant, these are great questions to ask so that you can see if maybe you can sign up for AFLAC or something like that to assist you while you are pregnant and after you have your baby. You can also make sure that you ask whether you're going to have the same provider throughout your pregnancy. That one's really important, especially because some providers might be retiring, they might be leaving their practice. So you want to make sure that you do ask those questions. And then also ask, what are your visits going to look like with COVID-19? A lot has changed in the recent months, in the recent weeks and days. So everything seems relatively new. A lot of things are up in the air. And so I know a lot of pregnant women are very concerned right now about how their visits are going to look, whether or not they might get COVID-19. So we'll address some of those issues and what you can do, and also some stress relief tactics. Also, it's important that you go over your medical history for yourself and the baby's father. So that way the doctor knows what they should be looking out for, what tests they should be running in case you're at a higher risk for certain, genetic defects, or if they have to run a genetic defect test, they can do those things. And then also reporting any medicine you're taking. Very important, because a lot of times when you're pregnant, it's a very delicate time. You want to make sure that you're not taking medications that might cause you to go into early labor or any sort of supplements. Even if they're all natural, you just want to be careful with those because you could start having early contractions. And then also understand that, your significant other may not be able to come to all the appointments with you, or any at this moment, because I know a lot of doctors' offices are not allowing that the significant other come with the individual to the appointment because they want to reduce the risk of transmitting COVID-19 at this point. So you can always Zoom during your appointment, you can always FaceTime or do Skype, or just call them on the phone so that you can feel that they're there with you. Okay, so here's what you can expect at your doctor's visit. So when you go physically to your doctor, they're going to check your temperature at the door and give you a mask because of COVID-19. We want to take those precautions to keep everyone safe, including you. They'll also do a physical exam of you. They're going to check to see if you're overweight or underweight, and whether you're overweight or underweight, they might go over some eating tactics with you to either help you to gain some weight, to have a healthier pregnancy, or they might also, talk to you about how to manage your weight better, maybe meet with a dietitian, refer you out to see a dietitian. I know a lot of times in our department at Beaver Medical Group, we do see a lot of gestational diabetes. We see a lot of women who are looking to manage their weight during their pregnancy. Of course, you don't want to be losing weight or going on any sort of diets, but just managing it, making sure you don't start to gain excess weight. And then also they're going to check to see if you have any sort of physical swelling. So if you've had swelling for a couple of days, maybe even weeks, you definitely want to make sure you talk to your doctor about that. Swelling is normal with pregnancy, especially around your ankles, possibly your hands, especially when it's also hotter outside. But if you notice that it's chronic, meaning that it's lasting a couple of days or weeks, that could be a sign of high blood pressure during pregnancy, which for a fancy term is preeclampsia. So definitely something that they monitor, something to be aware of. The other thing they're going to check is the baby. They want to make sure the baby is okay, and they'll do that by checking through an ultrasound. So I know that right now, again, because of our current circumstances with COVID-19, some ultrasound appointments might get not canceled, but they might be doing them less frequently just to protect you and protect you from the risk of getting COVID-19 from coming to the doctor too many times. So you'll have to talk to your doctor about that and see whether or not they're going to want to do the regular ultrasound visits, or if they're going to want to just do a couple of them, especially if you're relatively healthy and the baby's healthy. They may not want to do them as often. They're also going to check labs. So they're going to check for sugar in your urine, as well as excess proteins, bacteria, and then they'll see if you're dehydrated. So with sugars, if you have excess sugars in your urine, that could mean that you have gestational diabetes, so they'll run some further tests to see what your A1C is and how you're doing with your sugars. They're also going to, again, test your proteins or your urine to see if there's excess protein. If there is, that again could be a sign of high blood pressure during pregnancy. They'll also check for bacteria. UTIs are really common in pregnant women, so they'll help you with that and make sure that that doesn't get out of control. And then dehydration is really, really important that you stay hydrated during your pregnancy, because becoming dehydrated could cause you to have early contractions and go into preterm labor. So make sure that you're staying hydrated throughout your pregnancy. All right, so question number 2. How often should you be going to the doctor before 28 weeks? What do you think it is? Is it never? You should never go to the doctor. Daily, because you love your doctor maybe, or on a monthly basis? Which one do you think is the answer? All right, so you're going to be going on a monthly basis. As of right now, this schedule still stands. I know that there might be a new model for care in the future because of COVID-19, so I do want to address that. But as of right now, this is the prenatal visit schedule. So before 28 weeks, you'll be going on a monthly basis. From weeks 28 to 36, you'll be going every 2 weeks, so they're going to want to see you more frequently. And then weeks 36 to birth, they'll see you on a weekly basis. Now, because of COVID-19, I'm not sure if I put it, yes, there might be a new model of care coming in the future for pregnancies. We're not sure yet what hospitals and clinics are going to be adopting this new model, but it is something that you want to be aware of so that you know this may be coming. Nothing to be overly stressed about. There are many countries and many studies that have shown that less visits doesn't mean that you have a worse pregnancy outcome. Actually, less visits with a low risk pregnancy can have just as great outcomes as going to the doctor more often. So it's important that we do protect you and the baby, especially you, from COVID-19, because you can't the baby can't get COVID-19 in the womb. As of right now, there's no research that shows that the baby can get that. We want to protect you as much as possible. So they may be asking you to come less frequently, especially if they see that you're healthy, that you're normal weight, that your labs are coming back normally. They may ask you, hey, do you feel comfortable possibly doing telemedicine, where they're going to contact you via phone or via some sort of Zoom or something HIPAA compliant, so that they can see you face to face on the computer. So that might be something that they may ask you to do and see if you're comfortable with. They may also ask you to do less ultrasounds and lab tests, especially if you are relatively healthy and you aren't a high-risk pregnancy. Now, high-risk pregnancies are things that are individuals who have possibly high blood pressure, gestational diabetes, who may be carrying twins. Those are more high-risk pregnancies that they may want to see more often. But again, if you're low risk, then they're not necessarily going to ask you to come as frequently. So again, it'll be a combination possibly in the future of telemedicine and clinic visits. And the clinic visits will be used specifically for ultrasounds and lab tests that we just discussed. So definitely ask your doctor to see what your personal visit schedule is going to look like. I did just recently talk to a couple of women who are pregnant, a couple of friends of mine, and they said that their schedules have been the same, that they haven't been changed. Some things are a little bit different, which I'll explain later, but for the most part, theirs are the same. But I did do some research, and I have found that some hospitals and clinics around the country are already starting to change their model of care. So I thought it important to bring it up to you guys just so that you're aware of it and that you feel safe knowing that it's okay if this new model is taken into consideration and implemented where you're going to get care. All right, so here are some commonly asked questions about COVID-19 and pregnancy. I wanted to again address this because this is the time that we're living in now. So I know that the data is evolving very quickly, and it's like on a day-to-day basis that we're getting new information, new research, and so bear with me if this is accurate right now. It may not be accurate in 3 weeks to a month, but we're doing the best we can with the information that we're getting. So one question is, are pregnant women at higher risk for COVID-19? No, pregnant women are not at a higher risk. Now, just because you're pregnant doesn't mean that you're more likely to get COVID-19, but if you were to get COVID-19 when you're pregnant, you're at higher risk for having pregnancy-related complications. So again, because it's kind of like a flu where you will feel sick and you might have to lay low for a while, that would be the issue. So you do want to protect yourself and your baby. Wearing a mask, making sure that people around you are wearing masks, things like that would be really important. The other question is, can a mother transmit COVID-19 through the womb? As of right now, research does not show that you can do that, so the baby cannot contract COVID-19 from you if you were to get it. The issue would arise if you were to give birth and you had COVID-19, you could pass it to the baby after giving birth, just like a cold or a flu or something like that. So the hospital will make sure to take your temperature when you go in for delivery. They'll check your temperature throughout delivery as well, because they want to make sure that if you are getting sick, that when you do give birth, again, that you don't give it to the baby. So they're going to stay on top of that and make sure that they take precautions as you are delivering. So I already kind of mentioned the last bullet, so I won't go over that too much. Okay, so here's what you can expect during delivery. So some things, again, have changed in the hospitals. So if you're going to be delivering soon or in the near future, these are some things that you might face going into delivery. So again, nothing to stress over. We kind of just have to go with the safety and precautions that are being put out for us and just be as level-headed about it as possible, especially because we want to minimize the amount of stress that's put on you and the baby during this time. So just try to take things in stride, taking deep breaths if something is out of the norm. I know that some of us tend to be a little less flexible than others when it comes to changes, but just know that the less flexible you are and the more stressed you might get, it's not good for you or the baby. So just try to take things in stride, and if something doesn't seem is not routine for you or is not a routine type of care, just listen to the doctor and understand what the hospital new policy and regulations are. So again, as I mentioned earlier, everybody's going to be getting their temperature taken. You, your significant other, as well as all the doctors and nurses on shift, they all have to get their temperature taken. So you don't have to worry about that. The amount of visitors are being limited at the hospitals, so you want to make sure that you do ask about the policy there. And as of right now, a lot of hospitals are allowing only one person in the delivery room. So you can definitely make other adjustments to that. You can always, again, Skype, FaceTime your family members. If you're on Instagram, things like that, you can always stay connected. I know that one of my friends actually, throughout her delivery, was on Instagram, just posting about her story and letting people know how she was doing. And it was really good for her and for everybody else to have peace of mind that she was doing well. And she was there with her husband, but it is something to take into consideration that you can use those devices to stay connected. And then depending on your health status and where you're at with your delivery, if you're low risk and you're ready to go home, you might be discharged pretty quickly within 12 to 24 hours. And if you had a C-section and you're doing well, they might discharge you between 24 to 48 hours. So again, don't be surprised if you're discharged a little bit quicker. Okay, so the next question, true or false? Learning more about preterm labor can reduce your risk of having preterm labor. So definitely understanding what preterm labor is, your risks, and what to do if you think you're going into preterm labor can definitely help you to minimize your risk as well as the baby's risk. So what is preterm labor? Preterm labor means when you give birth before 37 weeks. So you don't go to full term, but rather your baby's born early. So there are risks associated with babies being born early, but thankfully, due to medicine and new research and really great hospital settings and nurses and doctors, babies who are born preterm have great outcomes. I have a lot of friends who had babies that were preterm, even one that had a baby at 20 weeks, and her baby's doing fantastic. But of course, it's still a stressful time, so you do want to know your signs and symptoms as well as what you can do if you think you're going into preterm labor. So typically what ends up happening sometimes with babies that are born early is that they might have breathing problems, harmful infections, or long-term health consequences. But again, those things are starting to diminish as more science and research and more medicine is coming out. So here are preterm labor risks. Here's how you can tell if you're going into preterm labor. So if you feel that your baby is starting to push down, you kind of feel that sensation, or you have some sort of low, dull backache that won't go away, cramps that feel like a period, belly cramps with or without diarrhea, contractions that are every 10 minutes or more often, a change in the color of discharge, spotting or bleeding, or possibly all of the above. So these are all signs of preterm labor. And what I would do is I would just take a picture of this right now. Make sure that you keep this handy with you so that you can always look back and say, hey, I'm not really sure if I'm going to preterm labor, but these feel like the signs of preterm labor. So here are 5 things that you can do if you think you're going into preterm labor. Make sure that you lay down, because as we're more active and stressed out, contractions may increase. So you don't want to start exercising or do anything active. Make sure that you lay low, lay down, and start timing your contractions with a watch. And take note of when they start and when they stop, so that you can then talk to your doctor and say, hey, these are what my contractions are at, what should I do, and that type of thing. Also, make sure that someone brings you water. If no one's with you, make sure that you call somebody to come and stay with you in case they need to take you to the hospital or to the doctor's office. So stay hydrated because dehydration can increase your contractions. Call your practitioner, and if you can't get a hold of them and your contractions increase or you have more signs and symptoms, then you'll definitely want to go to the emergency room to get better care and see what they can do to hopefully slow down the contractions and possibly stop you from having your baby so that you won't go into preterm labor. So again, make sure that you do these things, that you memorize what your signs and symptoms are, and you know what to do in case of preterm labor. Here are the individuals who would be at risk for preterm labor. So this is important to know as well. So if you identify yourself in one of these categories, then of course you want to be a little bit more aware that you could be at higher risk. If you've had a premature baby before, you're at higher risk. If you're pregnant with twins or more, you would be at higher risk. If you're under or overweight, if you have high blood pressure or diabetes during your pregnancy, have some sort of infection, have had premature births in the family, or are very stressed. So some of these things that you can manage very well, especially, your weight. If you have high blood pressure or diabetes, you can always connect with a dietitian and they can help you to manage those things. If you have infections, that's why it's important to get those lab tests done so that they know if you have a UTI. If you're stressed, we're going to talk about some stress management techniques that you can use so that you can have better outcomes for you and your baby. So true or false? The following are all ways to reduce risk of preterm labor. Going to your prenatal appointments, stopping smoking and avoiding secondhand smoke, not drinking alcohol, not taking drugs or herbal products that are not prescribed by your doctor, and staying active and healthy. So yes, these are all definitely ways that you can reduce your risk of preterm labor. I know that some of these seem pretty obvious, but it's important that I do make people aware that you don't want to be drinking or smoking during a pregnancy. Some people aren't aware of that, so it's a good thing to keep in mind. Also, some herbal products might be really strong and could cause you to go into preterm labor, so don't try not to take any sort of vitamins or minerals that you haven't talked to your doctor about. And then also making sure that if you are nervous about something, you can always call your doctor and let them know what's going on. And then definitely staying moderately active and eating healthfully can be huge, important roles in staying healthy during your pregnancy. So I mentioned staying active. You don't want to start an exercise routine that's really intense or start a marathon or start training for a marathon or something like that. But you do want to make sure that you stay relatively active. Unless, of course, your doctor asks you to stay resting because they're concerned that you might have contractions, then listen to your doctor. They might put you on bed rest, and I would definitely listen to that advice. But if you have a low-risk pregnancy, stay moderately active. Walk outside with a mask on, of course, staying 6 feet away from people. But if you have something at home that you can use, like a walking video, you can do a little bit of dancing at home. Again, nothing that's too strenuous, but it's just something to keep your blood pumping and making sure that you also don't necessarily gain too much weight during your pregnancy. So the other thing I wanted to mention was yoga. Yoga is really great. It's low impact, and there's a lot of prenatal yoga classes that you can take. You can always look them up on YouTube. You can also look at different yoga studios. Again, they're not open right now, but a lot of them are offering online classes at a discounted rate. The yoga studio that I love and go to is offering a lot of online classes, and right now their online classes are only $30 a month. So that's another option for you if you want to look into that. Okay, and the last thing I wanted to mention is meditation. So I don't think I put it on this slide, but what you could do, again, to relax, to recenter and refocus, especially if you're feeling a little out of control right now, which is totally normal. I know that we're in a state of unease. There's a lot of uncertainty about right now and our future. It's okay to have those feelings. It's okay to feel a little out of control, but it is important to know that you can regain balance and you can become more centered through meditation and deep breathing. So 2 apps that I would recommend are Insight Timer is one that I really love, and the Calm app. You might have heard of both of them or one of them, but they're really fantastic because they provide guided meditations that you can do anywhere, anytime, and can really just help you to relax your nervous system so that you can bring down that fight or flight. So right now we're going to go ahead and meditate. What you can do is just put your feet on the floor, relax your arms and your hands on your thighs, and just go ahead and take a deep breath in as I count to 4. 1, 2, 3, 4, and then sigh it out. 1, 2, 3, 4. Let's go ahead and repeat that inhale-exhale cycle a few more times, allowing your belly to softly rise and fall with each breath. And go ahead and close your eyes if they're not already closed. Okay, so go ahead and inhale as I count to 4. 1, 2, 3, 4. Hold it at the top, and then exhale slowly. 1, 2, 3, 4. Go ahead and inhale another time. 1, 2, 3, 4. Hold it at the top. And then exhale slowly. 1, 2, 3, 4. Slowly repeat this inhale-exhale cycle a few more times, allowing your belly to softly rise and fall with each breath. There's no need to rush. As you continue to slowly breathe, begin to bring your awareness to your body. Scan your body for any signs of tension and slowly let it go. Start from the top of your head and travel all the way down to your toes. Continue to inhale slowly and then exhale slowly. Scan your body once more for any signs of tension and slowly let it go. Your body should begin to feel very warm, heavy, and relaxed. You are fully present and in tune with your breath. Continue to inhale slowly and then exhale slowly. Notice how you feel right now, both mentally and physically. Do you feel more relaxed, more present? I encourage you to hold on to this relaxed feeling as you go throughout the rest of your day. The meditation will soon be ending, so begin to bring your awareness back to the room, noticing any sounds you might hear, and allow those sounds to guide you back. The meditation will end in 5, 4, 3, 2, 1. Go ahead and gradually open your eyes. All right, so I hope that you enjoyed that very short meditation. As you can see, it doesn't take very long to just start to relax the nervous system. The longer that you do it, the more relaxed you'll feel. So definitely give it a go. You can use Insight Timer or the Calm app that I mentioned, and those are both really great. I mentioned at the beginning that I would let you know some additional resources for you. I know this is, again, a time of high stress, and pregnancy in general is just sometimes very stressful, as well as, what's going to happen after pregnancy now that your baby is part of the world and a part of your world and your significant other. There might be some added stressors. So here are some things that you can here's a great resource that you can turn to. It's called PSI. It's Postpartum Support International. Even though it's postpartum, it is there and available for women who are pregnant and also who have given birth. And I believe it's available up to 2 or 3 years after you've given birth. This also includes dads. So a lot of dads do have stress as well after the baby has come. So definitely take advantage, dads, of this opportunity. They provide great mental health support as well as great other resources for you and the baby. You can always visit their website at postpartum.net. There's also another website for the COVID-19 resources. You can call anytime. They're open 24/7. You have the number right there at 1-800. You can also text them anytime, 24/7, at the 503 number in English or Spanish. And they also have online support groups. So they have private Facebook and Instagram, lots of great resources. So visit their website to get more information on that. And then also in the near future, we're going to be offering a support group, a postpartum support group for individuals to be able to come and get some more support from other like-minded women. So stay tuned for that. All right, so thank you so much for attending this class. I don't believe I have an end slide, but if you'd like to reach me, my email address is v.alardo@epicop.com. I appreciate you listening. If you have any additional questions or need some additional support, feel free to reach out, and I hope that you have a wonderful, safe evening.